Hi, my topic is intrauterine cannabis exposure and adverse effects on fetal development, and I'm going to be presenting information from my mini study analysis table. The reason I chose this topic is because, definitely for me, personal reasons, as well as clinical reasons. I feel like they kind of overlap for me living in Maryland and serving both Maryland and Washington, D.C., since I'm about 20 minutes outside of D.C. Um, Cannabis is legal in both places. So, cannabis is legal in 23 states of the U.S. now and also two U.S. territories, and also legal in the nation's capital, Washington, D.C. Being that I serve Maryland and DC, I need to know the facts surrounding safety or harm using cannabis. And so it behooves me to find out as much as I can and do my research. And I actually have had clients that already admit to continuing use of cannabis for the duration of their pregnancy. And I am a person who likes to be well informed, and I absolutely hate not having the facts to back any advice that I have for discontinuing use of anything or for continuing use of anything. In this case, I personally do not believe it's a good idea to consume cannabis, but we'll see what the research says. The first study that I am presenting is called Cannabis Use in Pregnancy and Maternal and Infant Outcomes, a Canadian cross-jurisdictional population-based cohort. This study is a retrospective population-based cohort study, and a summary of the results. Basically, it said that prenatal cannabis consumption does expose infants to a higher risk of major congenital anomalies, preterm birth, whether it was an induction that was medically necessary, or spontaneous birth, or spontaneous preterm birth, very preterm birth, small for gestational age, low birth weight, and large for gestational age. And the effect that it had on mothers who consumed cannabis prenatally was that they suffered a higher risk of cesarean delivery, and they also had a higher incidence of gestational diabetes. This study also further went on to look at whether the infant's sex, whether they were female or male, further impacted them. And in the case of the study, it did show that females seem to experience a higher incidence of those adverse outcomes at birth. The strengths of this study were that the data was gathered from a large, diverse population-based sample, and that infants with indeterminate sex were excluded. So they didn't try to decide what sex they thought the child should be. If it seemed indiscriminate, they couldn't determine what sex they were. And then also the fact that data collection practices were consistent between all three of the provinces of Canada that were included in the study. Um, the weakness of this study that for me was pretty glaring is the study made adjustments for the participants who used other drug substances rather than eliminating the participants. Um, I feel like this is a huge red flag. They made statistical adjustments, but in my opinion, I think they should have just deleted those people from the study or had them drop out. The second study that I'm reviewing is intrauterine cannabis exposure and fetal maternal blood flow. It's a case control study, a non-experimental case control study. And the conclusions found in this study were basically that only pregnancies where cannabis consumption was um, experienced or where the pregnancy or the baby was exposed to cannabis had an increased uterine artery pulsatility index and a decreased cerebral placental ratio. They interpreted that data to mean that fetal and maternal blood flow changes do occur during, in pregnancies that cannabis is consumed. One of the strengths of this study is that only low-risk participants were used in the study, and no participants were consumers of other drugs. The weaknesses of this study were that ages of cannabis group participants were not diverse, and this study did not track whether cannabis users used tobacco concurrently. And the frequency and amount of cannabis was consumed was also not a tracked factor. The third study that I am reviewing is prenatal cannabis use and infant birth outcomes in the Pregnancy Risk Assessment Monitoring System, also known as PRAM. It is a retrospective cohort study, and basically the study found that the greatest incidence of low birth weight was amongst infants exposed prenatally to cigarettes and cannabis concurrently. Low birth weight and small for gestational ages were likely in infants prenatally exposed to only cannabis. And then there was an instance of preterm birth weight and developmental size restriction that increased when cigarettes and cannabis were consumed concurrently also. The strength of the study was that a diverse, large participant pool was used and frequency of use was examined. The weaknesses of the study, or the weakness of the study, was that specific chemical composition of cannabis consumed was unknown. So they basically don't know the chemical component, which they consider to be a weakness. I hope this was informative. Thank you for your time.